FM 88.1 WHPR, Highland Park.
Turbulence.
We run Detroit radio.
What's happening? What's happening, Detroit and surrounding areas? You are listening to 107.5 HD2, and you could be tapping in via Facebook Live. And if you think you're going to miss it and you got to leave before we're done chopping it up, you can always go to the Real Black Coffee Detroit YouTube channel and always see what's going on with me. I had the perfect intro song for this evening, but you know, Facebook always want to block my videos anytime I play secular music. Sony need to quit doing that because I bought them CDs when it was out. I would have played Let's Talk About Sex, Baby. Let's talk about you and me. Let's talk about sex. Let's talk about sex, but I couldn't play that video because I know Facebook would have shut it down. But that's what we're going to talk about. We're going to talk about sex, and I'm calling this show Pain Before Pleasure because we have some kids who are doing some things that are causing them hospitalization, pain, STDs, and a lot of other things because they want to pleasure themselves. Talking about sex is always taboo. A lot of things I had to find out on my own. My mother's sex talk was, hey, I got pregnant with you at 17. You don't want to do that. So we went over to the Wayne County Health Department on the corner of Michigan Avenue and Merriman, and I came out with a brown paper bag with 6 months of birth control. And I was told to take those every day at the same time. Don't miss, because if so, I could become a teen mom like my mom. And she did not want that. I get it. But that was the sex talk. And it's so much more to it. But prior to that, what prompted it was in the 6th grade, I got to watch this video. So my mother had to sign this permission slip. And I got a chance to watch this birds and bees type video as well. But that was it. But it's so much more to sex than that. So I am going to bring on my bonus daughter. I love her so much. I met her when she was a very, very young girl. And she came up to me at church and said, "You pretty. Would you be my mama?" And I didn't know her from a hole in the wall. I said, "Don't you already have a mama?" She said, "I could have two. So I'm going to ask." And so she went, and she has been my daughter ever since. I want to introduce to you none other than Dr. Danielle Johnson Curry. Say what's up to everybody, sweetie.
Hello, everyone.
I can't.
Thank you for having me.
And hopefully everything is good for you. How was your day today?
It was kind of crazy,
I can't hear.
but you know, we make it do what it do. Worked all day, ordered groceries, got them delivered, came home, did a quick meal prep, and got ready.
Okay, good, good, good. Well, we're going to talk about sex because that's another one of your areas of expertise. And so we're going to have a conversation. Before we get into that, I want to preface this whole conversation with this clip. Can you roll the clip, Marquise?
Greetings, audience. My name is Thea. I'm a high school student, and today we're going to talk about sex. Operating on the assumption that you're human, you've almost certainly heard of sex. In case you haven't, to get you up to speed, sex is the process by which many organisms ensure their continued existence. Here's the thing, though. Sex is more complicated than that, because, spoiler alert, humans are complicated. So how do we learn about sex if it's so complicated? You might remember sex education like this. Urban Dictionary, your source for news and information about the 21st century zeitgeist, describes sex education as, quote, where they try to scare you out of having sex with pictures of diseased genitals. A more hopeful description of sex education would be something like a lifelong process of learning about sex and sexuality, exploring values and beliefs, and gaining skills to navigate relationships and manage your sexual health. This, as far as I'm concerned, is a solid definition. So what can we do to make sex education something that teens find actually, educational? Clearly, teens need answers to their questions. So where do people go when they have questions? Listen, I love the internet. It's one of the greatest developments in the exchange of information in all of human history. But much of what it says about sexual health is not accurate by any stretch of the imagination, or is so laden with bias that it feels more like being pelted with judgment than actually receiving information. Unfortunately, not every teen is willing and able to chat it up with their parents about sex, so if not always the internet, where can teens turn? Enter the peer educator. People my age do indeed talk to each other about sex, so when teens are sources of accurate information, it spreads among us quickly. As a peer educator, I belong to a program that gives me the tools to learn about everything from STIs and safe sex to contraception and consent. Basically, I can tell you more about human sexuality than the average adult. When teens see someone like me instead of someone decades older, they are quite receptive to the information I have to offer them. At lunch once, some friends wanted to know the difference between hormonal and copper IUDs. So I brought this to the table. Another day, my teacher didn't understand how emergency contraception works, so I explained it to the class. So what does it look like when teens approach me with questions about sexual health? It goes something like this. Venereal disease? STD? STI? This terminology, it baffles me. STI stands for sexually transmitted infection. We used to say STD, which stood for sexually transmitted disease, but it was changed recently because STI is a more medically accurate term, and taking away the big scary word disease helps decrease stigma. What the heck is trichomoniasis? Well, trichomoniasis is an STI usually spread through vaginal intercourse. It is curable with just one dose of an oral drug. Common symptoms, regardless of a person's sex, are unusual discharge, painful urination, and itching, but it spreads really quickly because most of the time it's asymptomatic, which means people don't realize they have it. That's why it's so important to get tested regularly.
Is it okay to be gay?
Yes, all people of all identities and backgrounds, including on the LGBTQ+ spectrum, can lead healthy and productive lives. Regardless of your beliefs, everyone has the right to explore and express their sexuality without the fear of shame or judgment.
Thanks.
So often, when my peers approach me with questions like these, seeking this or that piece of information, at least a sliver of what they're wondering is, am I normal? So let's talk about normal. Part of the point of peer education is to give teens the opportunity to understand that there is no such thing as the elusive normal. Peer educators are here to say that armed with information that empowers you to make informed decisions, you are going to be okay. Normal isn't really necessary. When you can get accurate, judgment-free information from your peers, you realize that sex ed doesn't have to be scary. So instead of striving to be normal, let's talk to each other. Since peer education allows sex ed to reach the community in ways that go far beyond pictures of diseased genitals, it turns out to be pretty brilliant. An idea that, unlike trichomoniasis, is certainly worth spreading.
So I thought that video was interesting because we know that children relate more to children than they do adults. Oftentimes, we don't talk to our kids about sex. When we do, it's like, don't have it. And that's it. We never address that the fact of having sexual desires and those feelings are normal, not abnormal, normal. And we also are becoming dismissive about the fact that sex is everywhere. billboards, YouTube, cable television, radio, cartoons, all of that. So Danielle, can you tap in and explain to our listeners, because we had a conversation earlier and you were like, babies even have a desire and it's normal. So give us your extra expertise, Dr. Curry.
It's hard to get into this one because it's so broad, right? And we can talk about this all day, especially if you grew up in church or what have you, or grew up with the baby boom as a parent. So like there really wasn't a sex talk. Our sex talk was, I'm pregnant and I was 23. So there was no conversation before that. But anyhow, pleasure is a normal thing for all living species. I mean, even when you look at animals, when you look at dogs, a male dog will hump his mother to desire pleasure, but he doesn't necessarily know that that's his mother. What he's seeking is that pleasure. So every living being has some sense of pleasure that they desire. And what we have to get away from is making it seem like it's strange or unusual or sinful or any of those words that you want to attach to it. Better, what we should do, though, is make sure we properly educate, because me personally, having 4 sons, I don't want them to learn from their friends. I learned from my friends, and that was dumb. I'd rather have an educated conversation with my children so that they know going in what they're dealing with and they can make better decisions than I did.
I agree, because I have a stat here that says currently 24 states and the District of Columbia require schools to provide sexual health education, and 37 states require schools to address HIV and AIDS education. However, the content and requirements of sexual health education can vary. Some states require abstinence-only education, while others require comprehensive sexual health education that covers a wide variety of topics. I have not. So you have 4 sons. Do you recall them having any sex education in high school?
No, not at all.
So I don't even know what they're saying when they say this. Are they considering taking a health class, sex education? Because it's not. It is not.
I do believe so. I do believe that may have been the only exposure. I never signed a permission slip. I know my mom signed a permission slip for me in about 5th or 6th grade. We never did that. The kids just told me they took health class, but I mean, I just took it upon myself because I didn't want my children to learn the way that I did.
Agreed. Why do you think? Why do you think it's a taboo topic?
That's a good question. Because it's used inappropriately, because of religion, because of the unknown, so many things.
So let's tap into one, because when you said because of religion, yes. And I think that, my stance on the church, and you know me very well when it comes to that, because we attended the same church for a long time. My stance is that we should be teaching that there. But if a young girl, let's just say she's in the choir and she has sex and she gets pregnant, she's set down and not allowed to continue on to be in the choir or a praise dancer or whatever until she has had the baby. Then she's allowed to go back. I never understood that among any other sexual things that occur that we are aware of in the church, but they are ostracized. That's one of the biggest problems. Stigma, being ostracized or whatever. And she should be embraced, because everybody in church having sex with one another.
Right.
It's a plenty of people that say, oh, you want to find a good man, go to the church. Okay, well, that's not true. That's a whole show by itself.
It's the one place I did not want to meet my husband. I knew, no. We know that God is gracious and we don't act right. So no, I didn't want to meet him there.
I just don't feel that any of that stuff should be taboo, but especially in church. We should be talking about sex. Stigma. I believe that our young kids are stigmatized by so much. So much. There are kids that are bullying. There are kids that are doing so much because they're trying to find themselves, because they feel some type of way. Even when they're suicidal, I've heard parents say they could have talked to me and said what? How can they explain to you that they want to pleasure themselves when they don't even understand why they feel like this is something that they want to do? So as a result of that, and not understanding that it is natural for them to want to be pleasured, I have had instances of children using toothbrushes for self-pleasure and a myriad of other things that are inappropriate, that can cause damage, that can cause hospital visits, and also STIs. Mm-hmm. It's time for us to have this conversation about self-pleasuring. Mm-hmm. I have heard of parents who have went out and bought items for their child to pleasure themselves because they were using things that were inappropriate. Tap in on that, Danielle. How do you feel, Dr. Curry? I want to make sure everybody knows that. Dr. Curry, how do you feel? I mean, a lot of people say, I would never go out and buy my child anything to pleasure themselves. No, that's inappropriate. I will not do it. That's enabling, and I'm just not going to do it. What would be your advice to a parent that is in that frame of mind?
So granted, it definitely depends on what works for your house. But for me, what helped me change my mindset was thinking about how it was approached with me. Had I been educated properly, I definitely would have made some better decisions. And that wasn't the case. So I think that parents in these situations should take a step back, right? It's 2023. It's 2023. Like, we have to open our minds. A lot of times we hear about people pushing away from their families or being suicidal because they can't share their sexuality with their families. Like, that's not okay. And to piggyback off of religion, especially in the Black community, we talk about, oh, that's a big cuss word. Oh, that's a big sin. Like, where is that in the Bible that it's a big sin? Gluttony is a sin. Lying is a sin. Adultery is a sin. Fornication is a sin. But we want to hone in on these things, whereas we are not giving each other grace. We're not providing that grace. And so for my kids, I told them, hey, this is going to happen. And they told me, no, it's not. I said, okay. When it happens, come and talk to me. Well, my son, my 16-year-old, he wasn't comfortable with coming to me with those conversations because he felt as if I shouldn't talk to my mom about these things. It's not that I made him feel that way, but somehow in his mind, I don't know where he got that from. He felt like I don't need to talk to my mom about this. And so years went by, and eventually he did come to me with these things, and my response to it surprised him. So the conversation went from him being informative to me having an adult-like conversation with you. Now that you've experienced these things, or now that you've had this exposure, conversation has to change. Mm-hmm. We have to talk about the responsibility behind it. Let's talk about the purpose behind it. Let's talk about soul ties. Let's talk about what this looks like. Let's talk about safety.
Mm-hmm. In the United States of America versus European countries, as much as we exploit sex on television, radio, cable, YouTube, cartoons, and everything else, for it to be taboo to have a conversation with your kid, where in Europe, they're wide open with this stuff, and they don't have nearly the rate of teen pregnancies, nearly the rate of STIs, nearly the rate of things that we have going on here. I agree with what you said. It depends on how you want to run your household. But if school is not talking to your kid about sex, and you are not talking to your kid about sex, who's talking to them?
Bring them to me. I'll do it.
Yes, because we don't have that peer educator that was in that video at the beginning was a very well educated, very well versed young lady when it comes to sex education. What we do is go to our friends and they don't know nothing. I didn't know anything about orgasms. I was having sex and thought I was really, really, really to the heightened of that experience until one day I had an orgasm. I'm way grown. Years after I began to have sex, I'm grown and have an orgasm. I thought somebody was electrocuting me or something. I can't even put into words what that was, but it was not the same as what I had been participating in all of those years. I swear to you, I was in almost 30 years old when this occurred. Had been sexually active at least 12 years. I didn't know what happened. And as a result of me not understanding what orgasm was, not understanding that there are levels to this sexuality thing, right? I ended up thinking that he was the best thing since sliced bread, which really didn't have a whole lot to do with him, somewhat, but not as much as I gave him credit for. Like, oh, he the bomb.com. He made me feel this way, when I was just in tune with my body. And as a result of that, this occurred.
Right.
I didn't want to go to my mom and say, oh, well, something just happened. I don't know what it was at 30 years old. I'm embarrassed. I definitely didn't want to tell him. So I'm just like, oh, okay. Did a little research and figured out what was going on. 30 years old.
Yep.
This should not have happened. And it should not happen with our kids. That's why we have the rate of teen pregnancy and stuff like that. And I'm not saying I condone abortion or not, but you can get rid of a child. But your kid can contract some things that you can't get rid of.
Yes.
So everybody thinks, okay, we have abortion, and whether you agree with it or not, it's available.
Yeah, baby, we can take care of, but some of these STDs we can't get rid of.
Exactly. Whether you want to get rid of it or take care of it, you better say it. And that's the thing. It is not abnormal for kids to have desires. And I understand, parents. I do. I am raising my great nephew, and I went in to wake him up from school one morning, and he had his hand in his underwear and he was holding himself. I thought I was going to pass out. Now he's sleeping. He's not doing this consciously. He's sleeping. But I'm like, oh no, he's discovering, that made him comfortable. There was no movement or anything like he was doing ejaculation or anything like that, but he felt comfortable doing that. No one taught him that.
Right.
He did it on his own.
The crazy part too is it's so much easier for males than it is, or people born with a penis versus it is for people born with a vagina or a vulva.
Yes. But so I did have a conversation with him, because now I notice him moving things around. And so I'm like, okay, well, let me have this conversation. So I'm like, I've noticed we've already had the talk. He's 10 and we've had to talk because I'm not waiting. He's exposed to it on everything else. So when I asked him, did he know how babies were born? And he said yes, but don't ask me to explain it because I'll have to say some things that might be a little disrespectful.
He said that?
Yes. Yes.
Oh.
So I'm like, okay, let's put the respect aside and give me what you got, because I want to make sure what you think you know is accurate. And he explained it.
Wow.
And he knew exactly what he was talking about. He did not hear it from his mother or anybody else. So you have to talk to your kids. And he's 10. And when I saw him moving things around one day in the basement, and I'm like, what are you doing? Because he's playing this with his VR. It's a game called Gorilla Tag or something. And so he's playing, and then I'll see him stop and do some shifting. I'm like, what are you doing? Making myself comfortable.
Yeah.
Okay. I mean, what do you say to that?
So this is good. This is so good. So we changed school districts when he was 10 years old, I believe. And a few years had gone by, and my 16-year-old said to me, they took my innocence away. I'm like, what do you mean? What do you mean they took your innocence away? He said they were talking about things at school that we hadn't talked about at home. I'm like, well, what are you talking about? He was talking about sex. So for me, I'm thinking he's 10, it's too soon. That's where I made my adjustment. So my 9-year-old, I approached that differently. I came to him and I said, hey, do you know what sex is? He said, no. I left it alone. We'll have that conversation when he's ready.
Mm-hmm.
Well, I'm not going to wait for him to come to me about it. We check in periodically.
Mm-hmm.
Where are you? What do you know?
As we should.
Again. The streets won't get to him before me.
Mm-hmm. As it should. Now, we've talked about kids who were born healthy, normal, or what we want to classify as normal for this conversation. But some children are born with disabilities and other abnormalities and dysfunctions. But not when it comes to sex.
Right.
They still have those feelings as well. I had a conversation with someone that worked in a home for people with disabilities and would catch them doing things to pleasure themselves in that nature. So let's roll this clip, and we're going to talk about approaching the conversation of sex with children who have special needs or something of that nature. Roll the clip, Marquise.
All kids, sooner or later, need to learn about the birds and the bees, and that includes children with disabilities. Natalie Williams is working on her PhD at Ohio University right now, and she specializes in the subject of sexuality for the mentally disabled. She also joins us here in our studio. Thanks for being here.
Thank you, Angela.
I wanted to start off and ask you, do kids with mental disabilities need the same kind of teaching about sex as children without mental disabilities?
Yes, Angela. Everyone goes through puberty. Everyone grows up. Everyone has those type of feelings. So yes, this information, it is more than just about the act of sex. So yes, I do think children with special needs need it as well.
Well, what is the best way of going about teaching children with disabilities about sexual education?
Children with disabilities, specifically intellectual and cognitive disabilities, really need a lot of repetition. And you can do the same things in different contexts to increase their ability to generalize to other situations, but definitely a lot of repetition.
And why is that repetition so important?
It's really important, especially considering the area of sexuality, because most of us get sex ed maybe once during a particular school year. And so children with special needs, in order for that info to really stick and to hit home, you're going to need to do it more than once.
And you brought a couple things here with you today. You brought one of these posters right here, and then you brought 2 books. Can you tell me a little bit about what these are and how they're used?
Sure. This game right here calls...
We can go ahead and hold it up too.
Sure.
So everyone can get a look.
It's a Go Slow Stop. It's an activity that I amended from Planned Parenthood. It's a way to teach about healthy and unhealthy relationships. So the stop would be in a scenario related to a situation of abuse. Slow would be a situation where maybe there's some uneasiness, not really sure. And then go would describe those healthy and safe relationships.
And can you give just like quick examples with this stop, slow, and go of what those situations may be?
A situation referred to as go, you could use little different scenarios relevant to home, community, or the classroom. So say, for instance, a student wants to sit next to another student that they really enjoy their company. So that would definitely be a situation go. A slow might be a situation where a student puts their hand on another student's shoulder, and we're generally taught to think that our private parts are those areas covered by swimming suits, but really your whole body is a private part. So in that situation, if you don't want to be touched, you could call that as slow. And then stop would be any areas related to, physical or sexual abuse where there's definitely, an unhealthy relationship there.
And what about these books? How do you use those?
These two books are really made for parents. One is called Sexuality and Your Sons and Daughters with Intellectual Disabilities by Schwar and Hingsberger. Another one by Terry Cohenhoven is for teaching children with Down syndrome about their bodies. So these are really just ways for parents to address the issue with their children.
Well, and you bring up a good subject. How do what advice do you give parents who do have children with mental disabilities and talking about this somewhat sensitive subject?
I would first say just don't be scared, because generally, as long as you're willing to broach the topic, you're really going to be providing them with helpful information that they may or may not get otherwise. So definitely don't show fear. And second of all, just become informed, use the resources that you have at your disposal, and just be willing to get out there and talk about these topics.
And very briefly, you do talk about a term called body safety when it comes to talking about sexuality with the mentally disabled. So can you tell me what that term means?
Sure. Body safety, also referred to as good touch, bad touch. It's really something that is very simple. You can start even as young as preschool age to help children name those body parts using appropriate language instead of some of the, this is my private parts. You really teach them the correct terminology so that if something does happen, they'll be able to, describe exactly and report situations of abuse.
Ms. Williams, it was a pleasure. Thanks for joining us.
So I like that video, and I recommend those who interact with children with special needs or disabilities, you have to have that conversation as well. I think even more so than you would in any other situation, because they need to understand not only what it is they're feeling, interaction with other people, what's appropriate, what's not appropriate.
That's huge. That's huge. Because sometimes the physical age doesn't match the mental age. Mm-hmm. So if I am physically 35 and I have the mindset of a 5-year-old, I need to be careful. I need to be taught how to conduct myself regardless of my diagnosis. My diagnosis is for the insurance company so they can provide support for me. At the end of the day, you still have to raise a productive citizen.
I agree. And we just, parents, aunts, uncles, sisters, brothers, you cannot be afraid to have this conversation. The streets are talking. Especially if you have, let's go back to my childhood. When I would be asked, maybe I'm 14, but I'm hanging out with my girlfriends and we see a group of guys, and I've always liked older guys. And they say, how old are you? I'm 18. I'm going to put that age up. Unfortunately, my body didn't match 18, 21 years old when I was 14. But let me tell you, my conversation did. That's just a sidebar. But let me tell you, some of these young ladies, 12 years old, their bodies look like they're 18 and 21 years old. And sometimes their conversation may be able to match that if the person who is pursuing them cares that much about it. Most of the time they don't. They're looking at that body and a hit it and quit it type situation. They're not looking for a relationship. Then your daughter encounters this situation. If she gets pregnant, she doesn't know who the father is. But let's put that to the side. Sexually transmitted infections. They need to know how to recognize that. They need to know what normal discharge is, what abnormal discharge is. When their body starts changing, what is normal and what is not normal. So, Dr. Curry, we talked earlier about oral health and how those things also have an impact on, or I would say sexual health has an impact on your oral health. Can you explain to the listeners what that means, Dr. Curry?
Okay, people. The tissues in our genital area, specifically the vagina and the vulva, or the vagina, I'll say, are very similar microscopically to the tissues in the tonsils. Okay. So the same STDs that we can have in our genitals, we can have in our mouth, and they can be transferred from the mouth to the genitals and from the genitals to the mouth. So some examples of that would be trichomonas, gonorrhea, chlamydia, HPV, herpes. HIV is like 1%, it's pretty low, but it's still an option.
Did you hear that, everybody? Say it one more time, because it floored me when I heard it. I said, what? Say it.
The tissues are the same. So we're also seeing an increase in oral cancer. So there's a vaccine, right, for HPV that covers about 3 of them, but it's really like 12. But those 3 are most common to turn into cancer. And so they're seeing a rise in oral cancer from HPV because of oral sex. Again, it can be transferred from genitals to the oral cavity and from the oral cavity to the genitals. It doesn't discriminate. So for those that say, oh, we didn't have intercourse, it was just oral sex, it is still sex. It is still a risk. It is still opportunity.
Yes. And I don't think, first of all, people are ashamed to talk about sex in detail. So I'm sure a parent wouldn't want to talk to their son or daughter about oral sex because it is a lot. But my point of this show, when I heard about the young lady who was utilizing a toothbrush for self-pleasure.
Did we talk about this being on TV? It was a TV show that had this on there?
No, I did not. Enlighten me.
There is a show. It's called Georgia and Jenny. And I can't remember which one is the mom, which one is the daughter, because I just started watching it because I wanted to see this because somebody told me about it. Because, they had to buy their child a vibrator because they were using a toothbrush.
At what age was this child?
12, 13.
Okay.
Right? So I haven't come across the episode yet because I'm just now starting it, but it was on this TV show. And so, of course, that gave people ideas about it. But even for the girl on the show, she's brushing her teeth and she gets this sensation. Something in her brain said, this would feel good on my vulva. Where'd she get it from? It just came to her. It was a natural thing. And it probably did feel good, but she used the bristles that were in her mouth, right? So bacteria is everywhere. So the bacteria that's in your mouth or potential STD from that bristle, now it's on your vulva. Now it has access to your vagina. Not only that, though, the bristles can scratch you.
Yes.
Bacteria can get embedded.
Yes.
You get an infection. Whole new problem. Not necessarily a sexually transmitted infection, a bacterial infection.
Mm-hmm.
When it all could have been avoided by proper education.
I agree. And so that's what this show is about. Proper education. You cannot wait until something happens with your child. And as a matter of fact, if they're not comfortable talking to you and they do notice some type of changes in their body that could be some form of infection, they may not even come and tell you. First of all, they don't recognize it, especially young men. They can go undetected for a long time before something even occurs. So we need
Let me give you a statistic. 1 in 4 women do not know where their vagina is.
What?
So here's something I've been working really hard on, okay? We always call the entire female genitalia a vagina. Let's stop that. The outside, that's called a vulva. The birth canal where the baby comes from the uterus to the outside world, that's the vagina. They're different. They serve different purposes. Okay, so 1 in 4 women don't know where their vagina is.
Okay, I was today years old. That I'll admit, I thought it was the whole thing referring to
it's it. Vulva, right? So I have a little personal assistant that I carry with me when I do my talks. I call her Tina. She's a chocolate vulva with a purple clitoris. She is beautiful. Because I need people to understand the dynamics of their anatomy.
And when I refer to it, even when I'm talking to children, etc., as the whole thing, and never really get down to the anatomy and physiology. I knew that, what you're saying, but when I say I was today years old, I don't use the appropriate language when I am having these conversations. So I have to correct that.
Yes. So different. So different. And I had that conversation with my boys, because never will you be out here in the world having experiences thinking that there is one hole, that women have one hole. That's not okay. That's not okay. I need you to know what's happening. I need you to know what to look for. I need you to be aware. Again, we can take care of a baby, but some of the STDs we cannot.
I agree. So with that being said, we are going to take a musical break. You have been listening to The Real Black Coffee, No Sugar, No Cream, and we're talking about from pain to pleasure, kids who are pleasuring themselves with toothbrushes and other things because we are not talking to our kids about sex. We'll be right back.
Mom, Dad, maybe what I was thinking.
Thinking what?
Someday, will we have a better future?
Someday. Lately is more than enough. Wow, serious.
De gente, andamos en guerra uno con otro y todavía tenemos mucho trabajo que hacer. Pero un día sueño que juntamos unidos como uno.
Here I am trying to understand. Why can't we be happy?
If love is the key to everything that we need, why can't we be happy? Someday will come. Someday will come. It will come together. Why can't we be a family?
That song was appropriate. It was called Someday, and that's by my cousin, the producers extraordinaire, Millard Thomas Jr. of Run of the Mill Productions. And it was called Someday Will Come, because that day is going to come where your child is going to engage in sexual activity and other things, and you want them to be able to come to you. And if they don't come to you, have them come to somebody. I'm that go-to person in my family, and I'm okay with being that, but have them talk to someone, because it is important. And one of the most important people that your child should be able to talk to, not just your child, anyone, is your healthcare provider. Having a primary care physician, a OB/GYN for a woman, and any other specialty care physician that you have a relationship is imperative. Those are the individuals who you should be able to ask. My doctor is my best friend.
Absolutely.
If I wanted to have an affair, I could tell my doctor. I wouldn't be ashamed if he said you had 1 partner, 2 partners, 5 partners, 7 partners, whatever. Answer that question when you are asked. How many partners? They're not asking you these questions for fun. They're trying to.
They're not asking to judge you either.
Exactly. There's no stigma or anything like that. They need to get information from you so they can do a comprehensive assessment and be able to take care of you and your needs preventatively. They don't want to be reactive. They're trying to be proactive. Dr. Johnson, I see your body language. Tap in. Let's go with it.
Listen, as a healthcare provider, we do not care who or how many people you're sleeping with for real, but that gives us the proper information to categorize you where we need to, whether you're high risk, low risk, what conversations we potentially need to have. It is not to judge you. So it's this, we just want to help. That's all. We just want to help. Have the conversation. Have the conversation. If there is a problem with burning with urination, or lack of moisture, or pain, or discharge, whatever, have the conversation so you can get the proper education. Now, at my 16-year-old, I want to say last year for his physical, the doctor asked him, do you want your mom to stay or do you want her to leave?
Mm-hmm.
I said, I'm going to leave. He's like, no, mommy, I want you to stay. That made me feel good as a parent.
Mm-hmm.
Apparently I'm doing something right, but I was like, I'm going to go to the car. I'm going to go out here and relax or whatever. He's like, no, I want you to stay. And they asked him if he wanted testing or whatever. And he was comfortable doing that in front of me. I was really proud of him for that. But I guess for him, he's like, I have nothing to hide. Like, yeah, you can stay. This is cool. But have the conversation. So even for me as a dental professional, like people want to come in and say, oh, I brush and floss every day. We know the truth. We know the truth today. It's okay.
We see that tartar.
we see them dumb. Like we know, right? It's certain things that let us know the truth or whatever. So just be honest about it. I can tell as a dental professional, if you had a little fun last night with some oral sex, it can leave bruises in your mouth. We can tell different conditions. We can tell if you have acid reflux. We can tell if you're anemic. Like your mouth is the gateway. That's a whole different conversation. But as a healthcare provider, it's super duper important just to be honest. We're not here to judge. We're here to help.
But it's important, and I'm glad you mentioned that, because people think when you go to the dentist, I'm just going to get my teeth cleaned and get the tartar and stuff off. When a dentist can tell so much more about your sexual health, about your physical health. The dental can tell a lot of stuff, but just looking in your mouth.
Listen, I got one better. Even though we're not talking about oral health, I'll tell you the story really, really quickly. I had a patient that came in that was growing fungus in the mouth, right? fungus like thrush. Which the vagina is a natural harvest for yeast. It's a whole balancing act. But again, it can be transferred, right? So this particular patient was growing yeast, and my questions were about the autoimmune system. How's your health? Do you have any autoimmune conditions? When was the last time you saw a doctor? When was the last time you had blood work? Long story short, she ended up coming back to me, sharing that she was just treated for cervical cancer. Right? So because she was immunocompromised, she grew fungus. That's not normal to grow fungus in your mouth. Because the necessary questions were asked, it forced her to follow up with her physician, and she got what she needed to still be with us today.
That's amazing. So again, you've been listening to The Real Black Coffee, No Sugar, No Cream with my special guest, my bonus daughter, Dr. Danielle Johnson Curry. And we're talking about from pain to pleasure. Kids who are self-pleasuring themselves with toothbrushes and other household objects because we are not talking to them about sex, sexual health, and the things that their body are transitioning to as a result of puberty.
Right.
It's not a taboo topic. Please talk to your children. There are appropriate ways to talk to them, you know, and I'm just still taken aback because we talk to our kids about sexuality. That's wide open now. Are you it's so many letters that's added on. I mess up. I can go from the LBGTQ plus now because I don't even remember the IA. I tell you, I mess up, right? We talk about all of them things that they can identify with as they experience with their sexuality. We need to go a little bit further with that, with the interaction. STIs can be transferred. It doesn't have to be from male to female. It can be from male to male. Yeah. Yes. When one genital touch another or another body part or opening.
Listen, let me tell you something that we don't talk about. And it's not very common since we wear gloves now as dental professionals. But there is something called herpetic whitlow. So this is back in the day when dentists didn't wear gloves. They got herpes on their finger. If you get the little juice from the vesicles on your finger, you can essentially, that's how herpes is spread. Type 1, type 2. You get the little juice on your finger, you could potentially get it on your fingers. So something that simple as your hands could transfer it to the genitals.
Mm-hmm. Or vice versa. How many times, you know, you've touched your genitals and then your hand goes in your mouth or whatever.
Oh my gosh, yes.
The same thing. So as we're talking about sexuality, LBGTQIA, and all of those other things, that's fine. I'm not homophobic or none of that. But make sure you talk about the sexual health aspects because once you identify, however you identify, eventually when you find a mate or someone that you care about, you're going to engage in sexual activity.
Correct.
And you can't have done what my mama did to me. Wayne County Health Department is closed, so you can't go there. And you know, everybody's sitting in the waiting area. When you come out with the brown bag, paper bag, everybody knew I came out with pills. That's embarrassing. I didn't want nobody to know. My mom, we sitting in the waiting room with everybody else. And I don't even know why she took me there. I guess just being cheap. I'm going to ask her when we get home. Because, Mama, you had health insurance. You had a good job. What made you take me over to the health department where I have to sit in a room with everybody? And I'm not demeaning the health department. I'm talking about the judgment and the stigma and being comfortable. I have went in that place and seen people from my school.
Doing the best good.
Sitting there in the waiting room just waiting, and you come out with your brown paper bag full of pills. Excuse me, lady, can we go to U of M? That's where we normally go for everything else, but you just didn't want to make that trip. Do what is necessary to make your kids feel comfortable. Parents, don't make them sit in the waiting room with everybody else if you don't have to. I was so embarrassed by that. And again, what my mama told me about sex was, I got pregnant with you at 17. You don't want to have a baby at 17. Take these pills every day.
The baby only, though. I mean, even as a community, we focus on the baby. The baby is the easy part. We focus on that. Like, no, I don't want to be a young grandma, but we can manage a baby. I don't want you to get, something that you have to live the rest of your life with, and you have to disclose that to people. That becomes a label. I don't want that trauma for you.
I agree. And I see my dear friend Stephanie on, and she said she had to go there by herself, but she knew what I was talking about. She knew the waiting room. She knew exactly what I was talking about. So there is a law in Michigan. I was elected to the Wayne County Pharmacists Association Executive Board, and I learned that you, as a teenager, you can go into the pharmacy and ask for birth control pills. You don't have to have a prescription. You don't have to have your parents with you. And they can give you those pills. Now, there'll probably be some other questions they may ask, insurance information, etc. They may not know. But if that child is currently picking up other prescriptions from there with you, and they go back without you and ask for contraceptive in the form of a birth control pill, it is not illegal for it to be distributed to your child. Now, a lot of people are like, don't give my child this, my child that. Look, Stephanie just said she went to the health department.
As a parent, like, that would hurt my feelings as a parent. So, like, each child is different. So my 9-year-old is very gentle. So when he shares information with me, I have to ask him, what do you want me to do with that information? Right? Whereas the older two, I would spaz out. It didn't matter. I didn't care. But I understand that, hey, if I spaz out, he's not going to share with me anymore. So let me.
She kind of froze a little bit, so I don't know. We'll wait and see if that can get corrected on her side. But while we see if she can come back in, I will say that, Dr. Curry did share where she went to the doctor with her son, who is 16. And when they got to the sexual health questions, the doctor asked her son, do you want her to stay in the room or leave? And he said, stay. And that's because she has cultivated a relationship with her son and already had these conversations. Therefore, it was no problem with him having this conversation with his mother in the room. Some children may be even afraid to answer that question. So be like, she can stay. But guess what's going to happen if a 16-year-old is having a sexual health examination and you have not had a conversation with your child, grandchild, or whatever about sexual health, and you stay in the room when the doctor starts asking those questions? They're going to lie. They're not going to tell the truth. So we must not make sex a taboo topic when it comes to our kids, our grandkids, nieces, nephews, any child that you have a relationship with. Please do not make sex a taboo topic. I was in tears when I had the conversation and found out that the young lady was pleasuring herself with her toothbrush. And as Dr. Curry stated, You're brushing your teeth with that, and then you think you're rinsing it off and it's good. It's not. So now you're using the same toothbrush there for pleasuring that you're brushing your teeth with. She mentioned that the tissues that are in your throat and tonsils, etc., mimic the same tissues that are with your sexual organs, and you can get the same diseases, trick, and any other STIs as a result of that. Please, and that is why I decided to have this show, because I am not afraid to talk about things that some people may not want to talk about, and we have to save our babies. Like Danielle said, and I stated, I'm not saying I'm for or against abortion, but people use that as a tactic to get rid of a baby. If you decide not to do that, you can take care of a baby. But there are some of these sexually transmitted diseases that you get that is no cure for. And you have to go through this regimented routine for a very long time, when all it would have taken was a conversation with someone who loved and cared about you enough to talk about that sexual health. It is so important. And I see Stephanie saying, she talks to her granddaughter if someone's touching and stuff. Yeah, we tend to have those conversations a whole lot more about inappropriate touching and stuff like that. But when it comes to the feeling and the pleasure, one thing my mother did say, though, I will give her credit. One thing she did say was, when we got those pills from the clinic, was when I had started my menstruation. And so she said, okay, take these pills, whether you're doing something or not, because you need to have them in your system and make sure they're working. Therefore, they can do their job of preventing pregnancy. I don't want to talk to you about anything other than that. But 6 months from now, we're going to come back and they're just going to give you another bag, and just continue to take them as directed, because I don't want you to be a teen mom like I was. And that was the sex talk. Nothing about diseases or anything like that. Now, we have more information available to us. Again, I'm almost 60 years old myself. So we're talking about a time where it wasn't a lot of resources and information available. So my mother did the best she could. I'm not judging her, but I'm just saying that's what happened to me as the sex talk. I was almost 30 years old before I realized what an orgasm was and really experienced it, right? Nobody told me anything about that. So therefore, have these conversations with your kids. There was no internet when my mother took me to the health department. There was no internet. There was not any YouTube. There was not all of these cable. We had 2, 4, 7, 9, 11, 13, 20, and 50 as television stations. We didn't have 200 channels to choose from, and the TV went off at 12 midnight. It wasn't on all times of night, where at that point I can watch explicit content. So you have all of these things that are available to our children for them to make decisions based off of what they're comprehending and the knowledge they have of that situation. And what I am saying to you is, it is important. I am glad that the children who are in my network, whether they are a client, a former client, or a relative, feel comfortable enough to share things with me so that I can give them information necessary to keep them from harming themselves, getting a disease, or having poor sexual health. I do feel it is important to have these conversations, because whether we want to admit it or not, they having sex.
Oh, yeah.
And these girls are very aggressive.
They are aggressive. Listen, my kids have only brought home one girl apiece. I have bigs and littles, my teenagers. They've only brought home one girl apiece. One is a sophomore in college, and one is about to be a senior in high school. But you best believe they going over there.
Yeah.
You best believe.
Oh yeah.
They going over there.
Oh yeah, and they're handsome too. Handsome fellas, and they know about it. And look, we pass out. So if there are condoms and things that are required, we have a clinic that is open from 10 to 2 at the Western Wayne Family Health Center in Inkster on Hamlin.
Oh, love that. I love that.
Get all of the free condoms and lube that you want. Our Belleville location.
Wait. You hit something big.
Okay.
Condoms and lube?
Yeah.
You can get lube.
Yes.
What?
Yes, because, and tell Dr. Curry, explain to them why the lube is important.
Okay, let me ask you a question. I'm going to answer your question with a question. Would you go down the water slide with no water?
No, but I don't mean to laugh. No, I wouldn't go down a water slide with no water.
You didn't go down the water slide with no water, right? So a lot of times you hear people say, oh, it's wet enough or what have you. But when the session gets long or that dries up, what happens? You get friction and you get vaginal tearing. And from that vaginal tearing, you can get vaginal scarring, you can get bacterial infections. So incorporating lubrication makes it more pleasurable for everyone. If you're getting up to go pee and it burns, that's not okay.
Mm-hmm.
That's not okay. He literally tore you up. That's not okay.
Yeah.
You are exposing yourself to bacteria.
And I think people don't understand that either. They are all in pain afterwards or whatever, and they consider that a good session. That is not.
That is not good.
But we do. So as part of our harm reduction program, we work with the state of Michigan Department of Health and Human Services and their HIV department and also their harm reduction department. So we have syringes and supplies and things of that nature that we pass out for safe usage for those who are injecting drug users, etc., in the areas where we have the ordinance on the books to do so. I wish there was decriminalization statewide, and at a stroke of a pen, it could be that nationwide, but that's just not how it is. So I have done a lot of advocating with individual cities to allow our program to operate. And so right now, outside of the city of Detroit, we were the first to do that in the city of Inkster, and then also Van Buren Township. And I'm hoping to approach Romulus and Belleville next. The reason why I'm being very specific about those cities in that order is I'm creating like an underground railroad, for people to be able to flow to and from our clinic spaces and cities safely, where we have this relationship with the police chief, the police department, and the powers that be to say, no, they're a SOAR participant, and they only have paraphernalia, let them go. Now, if you have any drugs or whatever, we can't do nothing about that. But clean syringes, clean pipes, condoms, lube, all of those things for proper sexual health. Yes, I have been advocating for it. And to go back to the church, not one joined with me. I approached him. Pastor Willis was ready, though. Pastor Willis was like, let's do this. You want to do the harm reduction program. I have experience. I know what is required, and we'll be on board at Pentecostal. But for some reason, the leadership in Romulus at that time wasn't prepared to embrace. So, but in the city of Inkster, and actually on May 17th at 6 p.m., we are having an event at the Inkster Dozier Recreation Complex talking about the criminalization of those with HIV and if you spread that disease to someone else. We have partnered with LBGTQ Detroit. No, IA. They're just LBGTQ Detroit. That's the name of their organization. And they're bringing out a panel, and we're going to have this conversation. So if you want to hear more about the criminalization of those. If you spread HIV, what does that look like if you spread it to someone else?
So let's be clear about this. Spreading it without the proper information so that your partner can make an informed decision.
Yes.
Versus
not
passing it.
Not saying anything.
Yeah. There's a difference there, right? So I don't think a lot of people understand that passing HIV without a person giving you the proper informed consent is a crime.
Mm-hmm.
If they have the informed consent, that's not the crime.
But you know what? A lot of people, because of stigma, because of racism, because of judgment, because of systemic racism, right? We must be honest when we have these conversations in talking about the difference between healthcare in disenfranchised communities versus other communities. It would be different. It can look different, right? And so we want to bring this program to the city of Inkster in conjunction with LBGTQ Detroit, because I want to make sure our people do perish from lack of knowledge. So I want to bring it. Let's have these conversations so that people can understand what the laws are and how to help. When it comes to our children, I believe sex education, and it could be so much more comprehensive and robust than what I saw in 6th grade. But if that's all you got, show that.
Yeah.
Do something. I don't even know. And I'm sure it was a bunch of people who were saying, well, I don't want anyone talking to my kids about sex. Cool. I remember the permission slip having a place where you could opt in or out. But to totally abolish and not allow children who perhaps need the opportunity to participate, not to participate, to me is an abomination. That's an atrocity. I just don't feel like it's appropriate. And I'm speaking for myself, because if no one else is going to talk to my baby about it, then he's going through this situation blindly. Not having the ability to protect himself, not understanding what's going on. And every video game, it was a video game, I can't think of the name of it now, but they had prostitutes and they were carjacking and all of that. What was the name of it, Marquise? Grand Theft Auto. My engineer. Grand Theft Auto. Yes. So if your kid playing Grand Theft Auto, they already know how to pick up people on the side of the road. They know when people on the stroll and what's going on. Mm-hmm. These video games expose these kids to a lot. And so if you are not going to take it upon yourself to talk to your child, and when I say child, I'm talking 10 years old, if in fact you see some signs or noticing some things going on, when those video games say rated R, parental consent advised, or whatever, you better believe it's some sexually explicit content in there that you need to be having a conversation with your kid about. Because Grand Theft Auto, when I saw them people on the stroll and they were stopping, picking them up and carjacking and picking up the girls, I'm like, what kind of game? This is not a game for kids.
Yep.
But kids are playing it.
Mm-hmm.
So with that being said, we're going to prepare to close out. This has been a very interesting conversation, not a hard one for me to have. It may be a hard one for people on here to listen to, but I'm telling you, if you do not educate your kids about sex and sexual activity, then that's like putting them in the car with no seatbelt.
Right.
It's all harm reduction.
The statistics support that. You know, you're more likely to prevent unwanted pregnancy, delay sexual encounters because of the education.
Definitely. So, Dr. Curry, do you have anything you want to share with our listeners as we prepare to close?
Listen, if you don't want to talk to your kids, I am willing to do that. I will do that virtually. I will do that in person. I'm in Ohio. But don't let this topic go untouched. even when it comes to our young ladies and how to care for themselves on their menstrual cycles. I don't recall very many conversations about that, how to care for myself. And, this is too long for a tampon. This is too long for a pad. This is how you clean yourself. Let's deal with that. Let's deal with all of that. So if you need the support, here's my information. You can find me on Instagram and Facebook, JM Grand LLC. So J as in Johnny, M as in May, G RAND LLC. That's on Facebook. That's on Instagram. And that's the email at Gmail. Let's educate our kids. Let's not do this. Maybe you need the education yourself, because we're not going to pretend that we were not adults when we learned about our bodies. Just like your Chipotle order, you have to tell your partner your Chipotle order. It is not their responsibility. Their pleasure is not your responsibility. They can help, but your pleasure is your responsibility.
Absolutely. Absolutely. So parents, grandparents, aunts, uncles, talk to your kids about sex and sexual health. It is important. It is a conversation to have. If you're allowing them to watch cable TV, YouTube, play a video game, you need to have a conversation with that kid about sex. It doesn't have to be explicit as you would have with a teenager or an adult. You can have a very knowledgeable, educated, age-appropriate conversation about sex, because again, a child pleasuring themselves with a toothbrush that they brush their teeth with and going back and forth because they don't want to have a conversation with their parent, etc., about the feeling that they're having at 10 years old,
right,
is a problem.
So appropriate desire, inappropriate behavior.
Yes, because it's normal for them to feel that. But a lot of people will say it's abnormal for them to feel that way, and it's not. It's not. You are absolutely correct. Dr. Danielle Johnson Curry, my bonus daughter, I love you so much. You have made me so proud throughout the years, from that little girl who was 7 years old that approached me and asked me to be her mama. You have made me so proud. Thank you for sharing your knowledge, your wealth of knowledge with the listeners. And again, give your information so individuals can follow you and reach out for this newly launched venture that you have as a result of honoring your mother who has transitioned. So I appreciate you just letting her legacy live on through this adventure that you're on now. So give them your information once again so they know how to get in touch with you.
Absolutely. So JM Grand is the name of the business. So JM Grand LLC, that's on Facebook, Instagram, and the email address is jmgrandllc@gmail.com. And we can get you scheduled for virtual or in-person sessions, but I am located in the suburbs of Columbus, Ohio.
Well, thank you, honey. It's been a pleasure, and we will talk soon. Good night.
Good night.
So you have been listening to The Real Black Coffee, No Sugar, No Cream, where we were talking about taking pain before you reach pleasure. Young adults pleasuring themselves with toothbrushes and other household objects because nobody's talking to them about sex, sexual pleasure, and desire. As Dr. Curry so eloquently stated, appropriate feelings, but inappropriate behavior to address those feelings. With that, I am going to close. You have been listening to The Real Black Coffee, No Sugar, No Cream, where I don't try to daze you like you had a shot of cheap liquor or make you feel like I just spilled any tea. I'm just trying to give you factual information from a different perspective. And tonight, it was this perspective of Dr. Danielle Johnson Curry, and of course mine. And with that, next week we have a guest coming on that transitioned from female to male. And we're going to talk about all of the stigma and everything associated with that journey. So hopefully you can tap in. Good night.
The story